Hi, my name is Ken Sebastianelli, one of the medical directors here at the Jewish Home. I was asked to give a few words on the vaccine, whether it's safe, whether it's effective, and basically whether we should get the vaccine as both a staff and as a resident. Before I start about the vaccine, I want to talk very briefly about the virus. So far in the United States, the virus has infected 19 million Americans and has caused about 350,000 deaths. So we know that the virus is very contagious and unfortunately very deadly. The defense that we've had so far of the virus has been masks, hand washing, and social distancing. And although we're trying, it's not the most effective way to fight this virus. The most effective way to fight any virus is really a vaccine. The vaccine has a head start because the SARS-2 virus is in a family of viruses called coronaviruses. Coronaviruses mean crown, and there's a spike on the virus. That spike is very interesting. It's called a large surface spike protein. That's how the virus attacks or attaches to our cells, something called an ACE2 receptor. That's important because the vaccine was developed to block that virus from attacking our cells. We had a head start with this because there's other two coronaviruses that we started making vaccines for, but fortunately those other two viruses died out and we never really developed past phase 1. There's 3 phases to develop a vaccine, phase 1, 2, and 3. And all phases were followed by this vaccine. Phase 1 is, briefly, phase 1 is the safety and toxicity of the virus. Phase 2 is whether the vaccine has a immunological response. And phase 3 is also the safety of the vaccine, and it also is matched against a placebo, whether it's effective. That's why we want a vaccine to be safe and effective. This particular vaccine went through all 3 phases. One of the problems with people who question whether they should get the vaccine is whether it's been rushed. And we think, this has been, usually takes 11 years to develop a vaccine. This vaccine's been developed under 1 year. But it's extremely important to realize none of the steps, none of the phases have been cut with this vaccine. The reason why it's been so fast, developed so fast, is the warp speed. The government has given these companies money to do it, so there was no shortcuts on this vaccine. The 2 vaccines that we have right now that are FDA approved, Pfizer and Moderna, both went through these 3 phases, and at the end of these 3 phases, we found out that the vaccine is 95% effective, which is extremely high. Also, they realized the safety profile is very acceptable. Number 1 side effect, fever, about 16% of people. Other side effects, headaches, fatigue, malaise, probably 4% of people that got the vaccine. So we know that not only it's effective 95%, it's also very safe. When the World Health Organization asked countries worldwide, would you get a vaccine, the general population worldwide said about 72% said they would get the vaccine. Highest countries were China and Singapore and South Korea. They said about 80%. Lowest country was Russia, about 55% said they would get it. The United States was about 78%. The reasons given why they wouldn't get the vaccine was that 1, it seemed to be rushed, and that whether it's safe or not. 2, whether it's effective. And 3, some people thought that the virus that they would not get the virus because they were healthy subjects and they didn't have the comorbid problems. Well, over the year, what we have realized is the virus doesn't discriminate. It can attack anybody, and the vaccine for it is highly effective and very safe. So again, I started to talk about the defense mechanisms that we have against this virus. Hand washing, 6 feet apart, masks. That hasn't really effectively got rid of the virus. The best defense, without a doubt, is the vaccine. So as a medical director, as a physician, I highly recommend people get the vaccine. It's effective, it's safe, and if there's any questions, I'd be happy to ask them in specific questions, and thank you.